Hey everyone, so today we're going to be doing the mock question of the day number 5 for USMLE Step 1 and Step 2. So starting with the patient presentation, you have a 56-year-old male who presents to the clinic for severe pain in the right big toe. The patient states that the pain started yesterday and that he's been experiencing excruciating pain even with slight touch or motion. Otherwise, he denies any history of known trauma. On examination, the patient is also afebrile. You get an arthrocentesis, which reveals the presence of negatively shaped or needle-shaped negatively birefringent crystals. So what is the diagnosis for this patient? The options are gout, pseudogout, septic arthritis, and Lyme disease. Go ahead and take a second to pause the question if you need more time. The correct answer is gout. So there are two parts of this patient's presentation which kind of give away the fact that it's gout. One is the fact that the patient reports its pain in the right big toe, which in medical terms would be the first metatarsal, which is very consistent for the pain that patients with gout experience. Along with that, you also are told that from the arthrocentesis is that you see the presence of needle-shaped, negatively birefringent crystals. Those are also pathognomonic for gout, so I would remember that as well. So over the next few slides, we'll go over the clinical presentation, diagnosis, and management of gout. So starting with the clinical presentation, patients who have gout present with monoarticular joint pain, which is a fancy way of saying just pain in one joint. Most frequently, the pain happens at the first metatarsal or ankle joint, but by far the most common location is the first metatarsal. Generally, patients are afebrile, and it's important to remember if the patient does have pain in one joint in the setting of fever, that might make you think septic arthritis versus gout. Gout from a pathophysiological perspective is due to deposition of monosodium urate crystals, and these crystals may be due to either overproduction or undersecretion of uric acid. For the most part, symptoms resolve within 10 days, and some common risk factors for developing gout are diabetes mellitus, obesity, and alcohol intake. So how do you diagnose gout? For diagnosis, arthrocentesis helps a lot, and it essentially also helps you distinguish gout from other causes of similar acute joint pain like pseudogout and septic arthritis. For patients with gout and arthrocentesis, you're going to see the presence of needle-shaped, negatively birefringent crystals, like we talked about in our patient earlier. And negatively birefringent crystals is just a fancy way of saying that these crystals are yellow under plain polarized light. And we'll see that in 1 second. On arthrocentesis for patients who have gout, generally the WBC count is between 2,000 and 50,000. If the WBC count is over 50,000, that makes you think something like septic arthritis. So what is the management of gout? There are 3 things that you should remember: NSAIDs, colchicine, and glucocorticoids, which are all used for acute flares. Of note, NSAIDs and oral glucocorticoids can be much more effective than colchicine. For chronic gout flares, you can use urate-lowering therapy, but these acute urate-lowering therapies have no role in acute gout, only in chronic management of gout. Lastly, I just want to go through the differential for gout. Given the fact that gout has a pretty non-specific clinical presentation of monoarticular joint pain, there are a lot of things it can mimic. One of the things that you should always consider is pseudogout. Whereas gout is due to deposition of monosodium urate crystals, pseudogout is due to deposition of calcium pyrophosphate crystals, and it can be distinguished pretty easily through arthrocentesis, whereas on pseudogout you're going to see positively birefringent rhomboid-shaped crystals. Another thing you should consider on your differential for gout is septic arthritis. Both septic arthritis and gout are associated with joint pain, but the key thing you want to remember about septic arthritis is that patients are generally going to be febrile, and along with that, when you do arthrocentesis for septic arthritis, the WBC count will be over 50,000, whereas for both gout and pseudogout, the WBC count will generally be between 2,000 and 50,000. And I think that's going to be it for today.